For young children, unintentional injuries are common and a leading cause of death. National guidelines recommend that pediatricians counsel parents about preventing injuries during well-child checkups. From prior research, we know that injury prevention programs can help parents gain knowledge and even adopt safety practices, but few show they work to reduce injury. We also don't know very much about minor injuries at home when children don't come in for medical care. The Injury Prevention Program, or TIPP for short, was developed by the American Academy of Pediatrics in 1983. It was designed to guide pediatricians to give developmentally tailored injury prevention advice to parents at each well-child visit. So, for example, the TIPP program uses materials like these to remind providers to suggest that parents put in stair gates before children learn to move in order to prevent falls. But as far as we know, there haven't been any experimental studies to test whether the TIPP program is effective for preventing injuries in young children. To test TIPP's effectiveness, we conducted a trial at 4 academic medical centers. 2 of the 4 centers trained their pediatric residents to use TIPP screening and counseling materials at all well-child checks from age 2 to 24 months. 2 centers were control centers, not trained in TIPP, that implemented a different, unrelated intervention. We then enrolled 2-month-old children and their parents at the 4 centers. At each well-child visit, a research assistant asked the parent in English or Spanish to report how many times, if any, the child had been injured since the prior visit. For each injury, the parent was asked also to report the type of injury and whether any of the injuries required medical attention. Our study results include 781 parent-infant dyads. More than half of parents were Hispanic, more than a quarter were non-Hispanic Black. Over 85% were insured by Medicaid. Reported injuries increased over time. At 2, 6, 12, 18, and 24 months, parents reported at least one injury in 3, 9, 25, 31, and 40% of children, respectively. At 24 months, 22% of parents reported at least 2 injuries. The most common type of injury was a fall, which was reported over 600 times. In a distant second place for injury type was other, which varied in parent description from plant fell on my child to my child was scratched by another child. Burns were reported 31 times. Thankfully, in the whole study, serious injuries like choking, poisoning, motor vehicle crashes, and near drowning were reported very few times. Injuries requiring medical attention increased over the first 2 years of life, but overall, fewer than 1 in 5 injuries, or 16%, required medical attention. Overall, we found that the TIPP intervention worked to prevent injury in young children. Families at TIPP sites reported significantly fewer injuries throughout their children's first 2 years. From the statistical models, we estimated that the risk of reporting injury across all scheduled well-child checkups averaged from 4 months to 24 months was 30% in the control group and only 14% in the TIPP group. Our study did have limitations. The biggest was that this was a cluster randomized trial with only 4 clusters. We tried to control for differences in the sites, but residual confounding may exist. Further research is needed to increase injury counseling. Factors such as lack of time are likely at play. But our cluster randomized trial shows that overcoming barriers and implementing the AAP TIPP program could prevent many injuries for America's young children.